Prepare for rising Medicare costs in 2026. What you need to know. Brace yourself. Healthcare costs are set to climb faster than they have in years. And if you rely on Medicare, you could be facing a much higher monthly bill in 2026. These increases are already stirring up debate. So, let's break down the numbers, the reasons behind them, and spark some real talk about what this means for your wallet and future. Medicare premiums and out-of-pocket expenses tend to rise every year. But the hike coming in 2026 is poised to be the steepest for Part B since 2022. According to projections from the Social Security and Medicare Trustees' latest report, the standard monthly premium for Medicare Part B is expected to soar by 11.6%. What does that look like? In concrete terms, you could see a jump from $185 in 2025 to $206.50 a month in 2026. That's an extra $21.50 per month, nearly doubling the 6% rise predicted for 2025. To put it in perspective, this is almost identical to the $21.60 monthly hike seen back in 2022, which was met with plenty of frustration from retirees living on fixed incomes. But here's where opinions start to split. While many consider this increase inevitable due to rising healthcare costs and an aging population, others argue that such steep hikes place unfair pressure on those who can least afford it. Where do you stand? Switching over to Medicare Part D, the prescription drug benefit, the story changes a bit. Part D plans come from private insurers, and the premiums aren't fixed by Medicare itself. But the trustees project the base monthly premium will reach $38.99 in 2026. The average premium is almost always less than this base rate, since your actual cost depends on the plan you select. For example, if you join a high-deductible plan with few extras, your premium could be below average, but you might face higher costs when you actually need prescriptions. And this is the part most people miss. Even if you get a cost of living adjustment, COLA, to your Social Security benefits, in 2026, that's projected at around 2.6% to 2.7%, which translates to roughly $54 more each month for beneficiaries. Much of that increase will be eaten up by these surging premiums. Almost 40% of the average monthly COLA increase could disappear to pay for the higher Part B premium alone. Since the Social Security Administration deducts Part B premiums directly from your benefit checks. That's a bitter pill, and it leaves many feeling like their so-called raises barely put a dent in today's real costs. Let's get clear on what Part B covers. This portion of Medicare helps pay for doctor visits, outpatient services, and some at-home care. In 2026, the deductible for Part B is expected to rise as well, hitting $288, a jump of $31 from 2025. That's up 11.2%, effectively matching the jump in premiums. Part D works differently than Part B. There's no set premium. It varies by the plan. However, recent laws play a big role in controlling costs. The Inflation Reduction Act introduced a premium stabilization program to prevent sudden, drastic increases in premiums. For 2026, this program is still in effect, meaning the most a base beneficiary premium can grow is capped at 6% annually. This aims to shield beneficiaries from the worst cost spikes, with the government picking up more of the tab if insurer expenses run much higher. More changes are on the way for prescription drug costs, too. The standard Part D deductible is projected to go up to $615 in 2026, from $590 in 2025. However, there's a small win. The annual out-of-pocket cap for drug expenses rises to $2,100, only $100 higher than this year, after which you won't pay any more for covered medications for the rest of the year. Some celebrate this move as tangible relief, while critics argue it's still not enough to protect vulnerable patients from financial hardship. Now, let's talk practical steps. During Medicare's open enrollment, mid-October to early December annually, you have a window to change plans or add new coverage. Here's where knowing premium and deductible projections really pays off. Your costs depend not just on your chosen plan, but also your income. Higher earners may owe a surcharge called the IRMAA, Income-Related Monthly Adjustment Amount. For 2026, your IRMAA will be determined by the modified adjusted gross income on your 2024 tax return. While you can't rewrite history, smart tax moves now might lower your surcharge in later years. For example, converting part of a traditional IRA to a Roth IRA could reduce your future taxable income and thus your Medicare premiums. Why does all this matter? Because Medicare's rules and your options shift frequently. CMS, the Centers for Medicare Medicaid Services, is rolling out new figures and some technical tweaks for the 2026 plan year. If you want to stay ahead, keep an eye out for updates or subscribe to expert newsletters breaking down the changes. And for those who really want to dig in, there are a slew of related topics making waves, like new prior authorization rules, cuts in certain approvals for Advantage plans, and proposed legislative reforms. Here's the big question. Are these rising premiums justified by the realities of funding healthcare? Or should policymakers find other ways to balance the books instead of leaning so heavily on retiree out-of-pocket costs? Weigh in below. Does the Medicare cost curve feel manageable? Or are you worried it's racing away from most Americans' ability to keep up? Final note. The premium numbers are based on projections from the annual Trustees Report. The Centers through Medicare Medicaid Services will release official figures in October 2025. There could be last-minute adjustments, so it's wise to keep following the updates. Share your take. Does Medicare's trajectory feel fair or flawed? Let's hear your perspective. Medicaid Part D Premiums 2026. What you need to know. Brace yourself. The cost of Medicare prescription drug coverage could be climbing sharply next year. And this isn't just minor fluctuation. It's a significant jump that might impact millions of seniors' budgets. But here's where it gets controversial. The average bid by insurance companies for 2026's Part D plans has surged by a striking 33% compared to last year, according to fresh data from the CMS. That's a substantial increase. And it hints at rising premiums for beneficiaries. Let's unpack what this really means. The average monthly bid that insurers submit to offer prescription drug plans for next year now stands at around $239.27. Meanwhile, the basic premium that a beneficiary would pay is estimated at roughly $38.99, a 6% hike from the previous year, which is the maximum increase legally allowed. This trend points toward higher out-of-pocket costs for many who rely on these plans. Adding another layer to the story, the CMS has announced it will maintain a voluntary trial program designed to keep premiums more manageable, but with some modifications. This demonstration program, first launched this year, intends to curb potential premium hikes, and although the administration considers its continuation a small win, the upcoming changes reflect a cautious step back toward typical market dynamics. For context, most Medicare beneficiaries have two main ways to get prescription coverage. They can enroll in a Medicare Advantage plan that bundles drug coverage or stick with a standalone Part D plan that supplements traditional Medicare. Insurance companies, which work under contracts with the federal government, submit bids each summer estimating their costs for serving an average beneficiary, covering benefits and administrative expenses. Regulators then use this data to figure out the overall average bid nationwide and determine the base premium, which beneficiaries end up paying. The difference between this bid and the national average, along with a federal subsidy, projected to be around $200.28 in 2026, up significantly from $142.67, helps bridge the gap. This subsidy is crucial because it influences the final premium levels. The upward trend in bids comes amid rising healthcare expenses generally, particularly with the climbing costs of medications like GLP-1 drugs. In response to these pressures, the CMS reports taking assertive steps to hold insurers accountable. negotiating bid terms and denying proposals with unjustified benefit reductions or significant increases in cost sharing. Furthermore, adjustments are being made to the pilot program aimed at stabilizing premiums. Historically, this initiative featured a $15 reduction in premiums and caps on annual increases. Next year, those reductions will decrease to $10, while the caps on premium hikes loosen to allow increases up to $50, and some of the risk management measures are being relaxed. This signals a shift back toward a more typical market environment, possibly inviting more volatility. And this situation raises some provocative questions. Are these increased bids a sign of underlying inflation in pharmacy costs? Or does it reflect insurers gaming the system? How much longer can beneficiaries absorb rising premium burdens before seeking alternative coverage? Share your thoughts. Do you think these premium hikes are justified? Or are they a sign that the system needs a serious overhaul? Medicare beneficiaries face prescription drug cost crisis in 2026. A silent storm is brewing for Medicare beneficiaries. Here's how to protect yourself. Millions of seniors are about to face a financial shockwave they didn't see coming, hidden in plain sight within Medicare's prescription drug program. While headlines tout stability, the reality is far more alarming. 2026 premiums are poised to skyrocket, and beneficiaries who ignore this warning could end up paying thousands more for life-saving medications. But here's where it gets controversial. The very policies designed to help seniors might be pushing many into deeper financial strain. Let's unpack the crisis and what you can do to avoid it. The hidden crisis. Why your 2026 drug costs could explode. The Centers for Medicare and Medicaid Services, CMS, recently dropped a bombshell. Standalone Medicare Part D premiums could jump from $179.45 to $239.27 per month in 2026. That's a 33% spike, but the story doesn't end there. In 2025, the average bid ballooned to $179.45, yet beneficiaries only paid $36.78 thanks to subsidies. This year, however, CMS is cracking down. For the first time ever, it rejected bids from insurers that proposed unacceptable cost hikes while raising its premium cap from $35 to $50. But here's the catch. These emergency fixes might not last. What happens when the temporary bandages are removed? The Inflation Reduction Act. A double-edged sword. The Inflation Reduction Act, IRA, passed in 2022, was hailed as a win for seniors. It introduced a $2,000 annual out-of-pocket cap, rising to $2,100 in 2026, and shifted more costs to the government during catastrophic coverage. On paper, this helps the 5% of beneficiaries with the highest drug expenses. But for the remaining 95%, the IRA has triggered a perfect storm. Higher deductibles, coinsurance, and volatile premiums. According to KFS, 85% of Part D enrollees now face deductibles in 2025, up from 67% the previous year. And this is the part most people miss. The law's redesign is backfiring for the majority. Coinsurance, the silent money drainer. Let's talk about a term that's confusing but critical. Coinsurance. Unlike copays, fixed fees, coinsurance means you pay a percentage of a drug's retail price. For example, take Eliquis, a blood thinner that costs $700 a month at retail. If your plan requires 25% coinsurance, that's $178 a month. At 33%, it jumps to $235. Far more than the $47 copay when it's on a preferred drug list. While this isn't common for everyday medications, it's a ticking time bomb for specialty drugs. And here's a provocative question. Should seniors be forced to gamble on unpredictable costs for life-saving treatments? We'd love to hear your thoughts in the comments. Market consolidation. Fewer choices, higher risk. The top 5 insurers now control 75% of enrollment. This consolidation isn't just about convenience. It's about power. With fewer options, insurers can dictate terms, and beneficiaries are left with limited leverage. Should the government step in to enforce competition? Or is this a natural evolution of the market? Share your take below. The shrinking safety net. Low-income subsidies under threat. Low-income seniors are feeling the pinch too. The low-income subsidy LIS program saw enrollment drop from 13.7 million to 13.1 million in 2025, partly due to Medicaid unwinding. Fewer people are shielded from market volatility, and the safety net is fraying. This raises a critical issue. Should the LIS program be expanded to protect more vulnerable seniors? Or is this an inevitable trade-off for broader policy goals? We're eager to hear your perspective. Your action plan. Don't let inaction cost you thousands. Open enrollment for 2026 starts October 15th. Ignoring this deadline could cost you dearly. Here's what to do. 1. Reshop relentlessly. Annual reviews are no longer optional. They're non-negotiable, says Mary Beth Franklin, a Medicare expert. Base your decision on your current prescriptions, not last year's plan. 2. Decipher the NOC. Plans will mail annual notices of change in September. These documents outline premium shifts, deductible changes, and pharmacy network updates. Even minor tweaks can add up. 3. Leverage Medicare.gov's Plan Finder. Starting October 1st, input your medications, dosage, and zip code to compare total costs across plans. Focus on total out-of-pocket expenses, not just monthly premiums. 4. Explore off-plan savings. If a drug's cost skyrockets, consider alternatives like GoodRx, SingleCare, or Amazon's Pharmacy. While it takes effort, the savings can be staggering. Some clients have saved $8,000 annually by switching plans. So, the bigger picture, why this matters to you. Medicare Part D is at a crossroads. Federal subsidies are propping up the system for now, but the underlying market is fragile. For most beneficiaries, the solution is simple. Shop aggressively, understand your coinsurance risks, and ensure your plan aligns with both your medications and budget. Failure to act could make 2026 the most expensive year yet. The question is, are you ready to take control? Or will you be caught off guard? Tell us what you think in the comments. Your voice matters.